When talking about the cinnamon tree, there's two things that we need to focus on: the twigs and the bark. And in traditional Chinese medicine, those are two different herbal ingredients. The twigs are said to warm the exterior, which is helpful with muscle pain and when you start to get cold and achy shoulders. The bark is said to warm the interior, to warm the kidneys. And when we look into the chemical components of the bark and the leaves, we find that there's two distinct chemicals that jump out. In the leaves and the twigs, it's called eugenol. And eugenol is the same thing that you find in cloves. It's when you bite down into a clove and your mouth kind of goes numb. That's the analgesic property of eugenol. And that's also in the twigs and leaves of cinnamon trees. Now the bark contains what's called a cinnamaldehyde, which is the classical like a cinnamon essential oils. And a cinnamaldehyde is really good at improving insulin sensitivity. Now, the cinnamon that you use at a store is harvested when the tree is about 2 or 3 years old, because that's when a cinnamaldehyde becomes in the highest concentration. But that's not the most medicinal ingredient. If we wait just a little bit, if we wait 10 years, as the bark matures, something interesting happens. As the bark matures, what happens is we see a slight decrease in the cinnamaldehyde, but we see a spike in eugenol, which is not normally in the bark. Also what happens is the bark starts to get really tough and dark, and it gets filled with resins and tannins. And those resins and tannins have an anti-inflammatory benefit. So what you end up with this older bark is a more complex ingredient. It has a cinnamaldehyde, it has eugenol, it has resins, it has tannins. And this complex ingredient also has a long history of being more medicinal. And this is the ingredient that is used in evil bone water. And that's why I use it in my clinic. And that's why I use it on my patients. It's just good stuff. Smell that cinnamon.